Good afternoon, everyone. I'm presenting a case of Sturge-Weber syndrome. This is this 10-year-old young female who presented in our OPD and complained of severe eye ache. Complained of severe eye ache in right eye more than left eye for 7 months, and she also complained of diminution of vision in both eye for 2 years, which was gradual, progressive in nature, and painful. The patient gave no history of birth trauma, intrauterine infections, no family history of glaucoma, no history of any other trauma or any ocular surgery in the past. On examination, the journal appearance showed facial port wine stain more on the right side of the face than the left side, with systemic examination which was within normal limit. On ocular examination, we find that the patient has ophthalmos with visual acuity of right eye 3 by 60 and left eye 6 by 60, which did not improve with pinhole. These are the images. And in the image, we can also see the port wine stain along with the ophthalmos, and the other image shows the bluish discoloration of the sclera. Conjunctiva did not show any discharge or congestion. And on slit lamp examination, the right eye show corneal diameter increased with corneal haze and half striae. And in the left eye, the corneal diameter was within normal limit with mild corneal haze, and half striae were also present in the left side. Anterior chamber show depth is deep with no cells and flare. The color and pattern of the iris was normal with pupil round and reactive. Lens was clear with no subluxation or cataract. The intraocular pressure with a short stonometer is found to be 37.2 mmHg with 10 grams weight, and in the left eye it was 30.4 mmHg with 7.5 gram weight. The ocular motility was full in all gauges, and on fundus examination, the cup disc ratio in right eye is found to be 0.8 vertical to 0.7 horizontal, and in left eye it is 0.6 vertical to 0.6 horizontal. There were no evidence of any choroidal hemangioma, and the fundus photo showed the cupping with no other signs in the peripheral central retina. This is the OCT of the patient showing that the intraretinal, preretinal and subretinal layers are within normal limit. On the basis of the ocular manifestations and skin manifestations, we diagnosed the patient as a case of glaucoma as a manifestation of Sturge-Weber syndrome. The patient was immediately started on eye drop timolol twice a time with tablet acetazolamide twice a time. The patient was also referred to dermatologist and neurologist for further associated systemic involvement. By looking at this case, we found that the early diagnosis and vigilant management remain the most important strategy to prevent the optic nerve damage and vision loss in that patient. That's it. Thank you.
How did you manage this patient?
Ma'am, the patient was started on eye drop timolol first, along with acetazolamide drug, and frequent follow-ups were done for the same. And
So how's the response to the treatment?
the IOP seems to get to low, was reducing, but it did not show much improvement. Now the patient is being planned for surgery.
Why didn't you use oral propranolol for this patient? Because it's such a wide extension and involvement of so much of tissues. So this patient can respond dramatically to that. Okay.
Yeah.
That's a great point. I think most of the ophthalmologists they know how to look for glaucoma, but they usually miss out on hemangioma. So that's what we should look for. So thank you, Dr. Neha.